Devin. Yeah, I know. It's been there.
No, put it right.
Apparently not.
I thought you could.
What took you forever to get here? What took you here forever to get here?
I was running.
I walked. What class were you in?
You're going under home now.
I was in this economy.
Okay, I think it's time to start. Got this review in the back. Push some of your heads down.
Just sit there.
Okay, quick little review. What % of high school kids in this country are not having sex? Yes.
60.5.
60.5. What % of high school kids consistently use condoms? Slightly more than 50, yeah. It's like 54, that's close. Exactly. What are the two categories? What's the B and the V stand for under STDs? And bacterial and viral, exactly. Which one can you kill? Which one can you kill? Oh wait, you had one a minute ago. Bacteria, you gonna catch? Okay, good. What are the two ways that they can be transmitted from one person's body to another? Blank to blank or blank to blank? Excellent, excellent. True or false? Spit can transmit an STD. Not normally. Well, I'm not going to ask you the other answer. You now know it's not. It's not a common way to transmit. It's a very unusual. A lot of times in HIV, people know how to transmit, and a lot of people thought that sweat transmit it, but it doesn't. It's blood will, sexual fluid will, mother to baby. It can also go that way. Okay. For two, can any or well maybe I'll do it for a sucker. Can anybody tell me the three bacterial diseases, C, G, and S? C, G, and S.
Chlamydia, gonorrhea, and syphilis.
Very good. Can anybody tell me the three H's? Three viral infections that are not curable. Three H's. Excellent. You guys are good at this stuff.
Sleeping.
Thank you so much. Got it. What is the big long word that starts with an A that means, nope, not going to do that? Whatever that is. Could be sex, could be drugs, could be...
Kid.
One word is all I was looking for. Actually unacceptable? Yep. Abstinence, exactly. It means saying no to something that you don't want in your life. It's saying no to it. At what point, is there only one time that can be done? No. Anybody can decide. Somebody may have made a choice to do one of those behaviors and decide, you know what, I didn't realize the risk, I'm done. And we call that renewed abstinence, but it's the same thing. It's saying no. It's just starting over. It's hitting the restart button. Okay, so today we are going to be seeing the, are we set up to go on this? Okay. So we're going to see the PowerPoint, and are they taking notes?
Yes.
Yeah, so make sure you got your papers.
So, for the first STDs with the slides, there'll be random ways that
I was like, what color are your
it's
pants?
treatable for how to catch it. So you gotta give me a couple for each one of those.
Fast. And you gotta write fast and in the dark. So we're gonna leave two open notes and go into the back, which has the last time.
The boys, guys.
Get your eyes accustomed to the dark so you can see your paper and what you're writing. Okay, program again called Choices Matter because they do. In the 60s, basically, there were two STDs. Syphilis and gonorrhea. They didn't refer to them that way, though. They called them venereal diseases. Now there's more than 25. The Centers for Disease Control make the list. And when enough people show up in doctors' offices with a disease that they got through sexual activity, and that happens with enough people within a certain period of time, it goes on the list. So we went from 2 to 25 pretty rapidly because of two things that happened. See if anybody can guess what they are. First of all, when sex ed in the 60s was basically, don't have sex, you'll get pregnant. So something was invented that relieved everybody's mind about getting pregnant. What do you think it was? Yes. Make a choice. Make a choice. Wrong choice. What? No? You had it on your second choice. Birth control pills. Birth control pills. Condoms were already around, but they still fail, just like they do now. Birth control pills were not perfect then, and they're not perfect now. There still is a risk of pregnancy, but it was new enough, and it was like, oh, well, I can have sex and not have to worry. And so people relied on that. But then there was something else that changed everybody's mind about should I have sex or not, even though I'm on the pill. It's called Woodstock. And it was a rock music festival out on the land in upstate New York. Nothing there but the stage. Because in those days, rock stars did not give many concerts. If it was in LA, New York, or London. That was it. And so you just listened to them on the radio or you bought a record. That was about it. So these promoters put this big thing together. They expected about 50,000 teenagers, well, college kids to show up. They would be the only ones that would be able to get there. So they expected about 50,000. Well, 500,000 showed up, 500,000. So the food trucks they'd arranged for and the portalets they arranged for became obsolete very quickly. The weather, it was 4 days, 24/7 music. They brought in generators for sound. They had a big stage and 500,000 people to watch. And it was going constantly. And then the rains came and it became very swamp-like. And but they didn't care. They were either on LSD or pot the whole time, so they were floating high and loving everything. And so when it got really muddy, they just took their clothes off, walked around naked. And if they wanted to have sex, they just played in the mud and had sex. If they wanted to go to the bathroom, they just went to the bathroom. It was a very they tried to have Woodstock too, and that was a failure. You cannot replicate that kind of event at the time. It was in the 60s, a very different time in our country. And so the thinking after Woodstock was basically have sex whenever you want, with whoever you want, however you want. Make sure somebody's on the birth control pill and get high first, it'll be better. That was the thinking. And that's how a lot of kids proceeded with their life. And they would have multiple partners at one party at the college. Yeah, they'd go to a party and they'd have like three matchings that just at the party, hook up with somebody. So so nobody's thinking about the STDs, and again, that took us now to where we have 25. Every year in this country, 20 million times, a doctor turns to a patient and says, you've got an STD. And then over in another state, a doctor tells the patient, you've got an STD. 20 million times. Now, we were so concerned a few years ago about Ebola, and it was on the news every single night, which I'm not saying is bad. It's not a bad thing. However, how many cases of Ebola were actually ever diagnosed? 4. It was on the news every night. Nobody's talking about this. Nobody's talking these huge numbers. This is an epidemic. And the numbers right now are for chlamydia, gonorrhea, and syphilis, the 3 bacterial infections, are higher than they've been in probably 30 or 40 years. They're huge right now. So today, while we're in here, over 2,000 people are finding out they've got an STD. Now, it's not necessarily 20 million people, but it's going to be close to that, because one person may come in several times. There may be people out of that 20 million that come in 2 different times during the year, and they have 2 different cases, 2 different infections. So that can happen, but it's going to be close to that, which is huge. Now, how's that play out for you guys? Well, you get half of them. 15 to 24-year-old young people get half of the STDs. That age group is about a quarter of the population, but yet half of the STDs. Because they're the ones saying, oh, it ain't going to happen to me, I'll be careful. It does happen to the tune of 10 million diseases a year. As I said yesterday, it's transferred skin to skin and fluid to fluid. Now, this chart the numbers down this side represent the number of people that you would be with face to face, body to body in some kind of sexual activity. It could be intercourse, it could be oral sex, anal sex, or touching one another's genitals. All of those will spread STDs. So these are the people you would be face to face doing one of those activities. It could be in a long-term relationship, 3-4 months or a year, whatever. It could be a one-night hookup at a party and you had sex with somebody. That counts as a person. So let's say that over several years' time, somebody had 5 partners, who had partners, who had partners, who had partners. You've exposed yourself to the chemistry of about 31 people, not just 5. Okay? Remember the handshaking. Yeah, it's not just who you're with, it's who were they with. So our chart goes to 12, and at that point, you're well over 4,000 that you're chemically exposed to. Let's do a little math problem for a minute here. What do you think is the average age, if somebody is sexually active as a teenager, what's the average age at which they start? What do you think? This is your opinion. There's no right or wrong answer.
15.
15? 17?
15.
So I got 15 and 17. Let's vote. Who says 15? Who says 17? Okay, 15's got it. Okay. Now, this is an actual number. According to the U.S. Census, what's the average age of a first marriage in this country? Just start yelling them out. I'll stop you when you...
18. 19. 11. 15.
Where are you going?
32.
28. I knew you were going to get there finally. 28. So 28 minus 15 is 13 years of messing around before settling down. Okay? So now another thinking question. If someone is a sexually active young person, how many partners per year might they have on average? If you look at all of them, what would be the average number per year that they might have? 3?
Yeah,
20. Let's go with 3.
Yeah, 20 people
Okay,
per
so
year.
that's
Holy shit.
39 partners. Now, if I had said that a minute ago, now, you know, if somebody had 39 partners, you thought, oh, ladies, lost your mind. But by your own math, somebody could have 39 partners. It takes someone years to do it. It's only 3 partners a year. But it adds up. 39, can you imagine? This number goes over 1 million when you do that. And you plug the 39 into that formula. It goes over 1 million. So the risks are there. But also look at this little emotional situation. Let's say that, you know, you're in your mid-20s and you're dating somebody and things are getting serious and you're having those serious conversations about, do we have a future? And this person turns to you and says, you know, you are so special to me. You know I've got a history, but, you know, and I know you're number 40, but you are really special to me. You laughed. Exactly. How special would you feel? Do you think that the person who's had that many partners, do you think the word love was ever used? Yeah. Do you think it means much to them anymore? No. Do you think even having sex with somebody represents a deep emotional experience anymore? Probably not. So again, this has consequences, not just physical, but it could have emotional consequences also. Okay, moving on. It's all sex. Vaginal sex, male's penis and female's vagina. Anal sex, using the anal opening for the insertion of the penis. Oral sex, contact between one person's mouth and another person's genitals, and genital touching, and that could be hands touching genitals, genitals touching genitals without intercourse. It could be a hip touching a genital. If 2 people are naked, making out, but not going to have intercourse, you can still get an STD, because it could transmit to your leg. Because if your skin is exposed, and it touches the genitals of someone who has one that is skin to skin, which is everything up there but HIV. Chlamydia, gonorrhea, syphilis, herpes, HPV. Skin to skin. Okay, that's all it takes. So any of these things, you know, people, oral sex became very popular as birth control. Well, I can't get pregnant if I'm doing that, and it's not really sex. Well, it's in the name. It is. They don't call it oral party game. It's sex. But a lot of people started doing it because they can't get pregnant. But man, the STD rates skyrocketed when oral sex became popular. And a lot of times then the infection is in the throat. So, yeah. And so an infected person could transmit to a partner even when they have no symptoms, and they definitely can be transmitted through oral sex. This thing gets precipitated if I push the button too fast.
You're a whore. Some drugs, man? Some good old drugs.
Okay, life isn't fair. Girls are more at risk for STDs than guys are. That's because, remember the pictures that we saw of the cervix yesterday, how immature the teenage girls look compared to the woman that was about 30. There's a major change that happens over those years. So as a teenager, the tissue is very susceptible. But even on in life, a woman's tissue in the reproductive area inside the vaginal opening is a lot thinner and more susceptible to these infections entering her body through that tissue than the tissue of the penis of the male. So about 20,000 women every year find out they're infertile because of an STD they didn't know they had. So it can have dire consequences for a woman. Okay, the first of the STDs, chlamydia. Remember, we're supposed to write about 2 facts for each of these. Most frequently reported bacterial STD in the United States. Most infected people are asymptomatic. What does that word mean? Asymptomatic. Write fast. What does the word asymptomatic mean? You don't have to write out the whole thing. You can say most asymptomatic, and it'll mean the same thing as most people are. What does asymptomatic mean? They don't have symptoms, exactly. So they're probably not going to the doctor, and that's why these numbers can get so high. Chlamydia is also most common among young people. Get your 2 written down quickly, because we're going to lose activities tomorrow by going through this so slowly today. So write fast. Okay. Now, if you do happen to have symptoms, both males and females can have discharge. Discharge is your body's way of saying you've got an infection. If you get a cut and it gets infected, pus forms. I hate that word, but that's what forms under that scab, and it's red and it's infected, and you have to get that, get it opened up, get antibiotic on there to clear the infection. Well, in your reproductive system, the same thing forms, but you have an opening to the outside. But what comes out at any one time would probably fit on the end of my little finger. It's a drop. And by the time you might notice it, it's already dried on your underwear and you don't see it. So again, these are symptoms that you're not visible. If you're burning, you urinate, and for a female, there may be abdominal pain. But that's it. Those are the symptoms. And they're very similar when we get to gonorrhea. It's treatable with an antibiotic. However, no treatment or delayed treatment. Remember the girl in the video? She had chlamydia, and it messed up her reproductive system. They don't know if she's going to be able to have kids. Treatment doesn't reverse the damage already done. They'll get her on antibiotic, get over chlamydia, but the damage may not be fixable. Long-term effects of chlamydia, it can cause pelvic inflammatory disease in a female. It can cause either male or female to become infertile. It can also be linked to tubal pregnancies in females. Now, let me explain some of those things to you. This all sits in the abdomen of a female. Everybody make a fist with your thumb on top. That is about the size of a uterus when there's no baby in it. Now look at the bottom of your fist. See the little finger? That's very much what that cervix looks like, sitting at the base of the uterus. And what's the job of the cervix? Hold the baby in. It sits at the base of the cervix. It's tightly shut. If you make your fist really tight and you try to stick your little finger in there, it shouldn't go in because you're holding that really tight. And that's what that muscle does during pregnancy. It holds that opening tightly shut so the baby can grow and develop for 9 months in the uterus. And then when mom goes into labor, that begins to open and she can give birth to that baby. But the cervix holds it in. The fallopian tubes on either side are a passageway. Because once a month, one of the other ovaries produces an egg. It goes into the tube and it travels down the tube. Now, sperm swim, eggs don't. So there's little hairs in there that move it along. And it takes several days to make a little tiny trip. Because again, it's a slow process. It's often in the fallopian tube though. The cell wall breaks through it, you've got an embryo, you've got a baby on the way. That's where it often does happen. Now, if that doesn't happen, the egg comes on in here and then it begins to leave the body, goes on down through, and it can come out. Most girls never know when it happens because it's deteriorated so much by that time. Most girls never even know when it comes out. For those that are fertilized, they come in, the little embryo comes in and attaches to the wall of of the uterus somewhere and hopefully remains there full 9 months, held in by the cervix, growing and developing, and then born. Now, infections come in and they'll stop first with that cervix, infect it, and then because she doesn't know it's infected, they go through the cervical opening and they spread throughout her whole reproductive system. We call that pelvic inflammatory disease. It's a massive infection. It can do damage, great damage to the reproductive system. That's also with tubal pregnancies. Let's say that the little embryo gets formed over here. The fertilization has happened. The egg and sperm meet. Fertilization has happened. We have an embryo. But with all the scarring from the disease, swelling from the disease, it can't get through back to the uterus. It's stuck in the tube. Hence the name tubal pregnancy or ectopic. And it's stuck in that little tiny tube that the opening inside is about the size of 2 or 3 human hairs. So what's going to happen to the tube as that embryo starts to reproduce itself, 2 to 4 to 8? What's going to happen to the tube? It's going to break. Somebody's going to be dialing 911 because mom's now bleeding internally. Now, other things can cause tubal pregnancy, but this can. And so just understand that's the risk, if you get a disease you don't know you have. Okay, the first picture you're going to see is the healthy cervix. That's right, we hadn't seen this yesterday. Healthy cervix. You're going to see an adult down here and a teenager up here. You'll see the difference. This is healthy medical tissue. This is not pornography. It's just medical slides, okay? There's going to be a blank slide before every picture slide. And if you don't want to look, just look down. But please don't make sound effects. We don't do that, okay? Now, don't look at the size difference. Just look at the texture. It's very fragile looking versus very muscular. And that's the difference in the ages. And as the adolescent ages, hers will become more like this, especially after you have a child. It'll be very muscular. But this is going to be much more, the adolescent will be more susceptible to infections because it is a very fragile tissue at that point. Now here's the same piece of tissue, not necessarily that person, but it's the cervix, but it's infected with chlamydia. Stick your hand up if you think this looks painful. But 75% of the time she feels nothing. And that's why that infection can be so serious because it goes on into PID, because she doesn't know it's there. Okay, this next picture is of a woman's reproductive system. She was one that got chlamydia, didn't know it, got PID, didn't know it, got married, wanted to have kids, and like the girl in the video was concerned about, she couldn't get pregnant. And so she went to the Med Institute in Texas, which is where we get a lot of this stuff, they're the experts, and they did exploratory surgery. And they looked at her reproductive system to see what's going on. Here's her 4th trip. This is her reproductive system. There's the outside of the uterus, the fallopian tube attaching on either side. This is a medical instrument. She didn't swallow a stick. This is just fatty tissue. The blue is dye. And they insert that dye to see, is it flowing through or is it getting stopped somewhere? Well, you'll notice it's stopped at the end of the fallopian tube. What's it tell you about the end of the tube? Is it open or closed? Closed. What should it be? Open, because what has to enter there if you want a baby? Egg. Sperm would come in from that side. The egg has to enter there, but it can't get in. Now, I don't know, she's had 3 procedures done. I don't know if they tried to open this and it just keeps scarring over. You know that will happen with a pierced ear if you don't have anything in it. So maybe that's what's happening here. But even if that were open, does anybody see a problem with the tube? Remember the diagram. Slight arch. What's her tube doing? All crooked. So even if the egg could get in and never get past that kink, and the sperm would never get past that one, they'd never meet. That's why she can't get pregnant. Don't know if she'll ever be able to. Again, what kind of risk are you willing to take? DDDID, decisions determine your destiny, intentions don't. Now, babies can get these from moms. They test moms. If she's got chlamydia, for example, they would get her on antibiotics. They test them early in pregnancy. And if she has something, they'll get her on antibiotics. They'll get it taken care of. They'll test her again before she gives birth. Because babies can get it coming through the birth canal. The only exception to that is syphilis and HIV, which the baby can get while in the uterus if mom has an active case. So, babies can get these. So they test. If it's a viral one, they'll get her on antibiotics and then they deliver the baby by cesarean or C-section, which they make an incision, lift the baby out, sew mom back up. Please do not go home and ask mom if she had an STD because you were born by C-section. Don't do that. There's a whole lot of reasons why somebody can be born by C-section. So that's just one of them. Okay, so you can see that babies being born with these things can have dire consequences for a baby. Okay, Gonorrhea looks very much like chlamydia in how it presents itself, the kinds of symptoms it has. Often doesn't have any at all. If you do, you've again got burning when you urinate, you've got discharge, you may have some pain. Very similar. They would have to test you to find out which of these that you have. Some more facts. It's a common cause of PID. It can cause infertility in males, but it's not too common. Without treatment, it, however, can get out of your body and cause a life-threatening infection. These things don't necessarily just stay in your reproductive system. Chlamydia, for example, can affect your liver if it's in your body long enough. So they can get outside and cause other things, as it says here, and they can be very, very serious. Infected mothers can pass it to the baby, and you can see the kinds of things that can happen for a baby. Blindness, joint infection, blood infections. They dealt with this blindness issue years ago, even before my kids were born, and they're grown. Every baby born in a hospital in this country, one of the first things they do when they come out is they flood their eyes with antibiotic that kills this bacteria. And they're taking care of a lot of blindness because of that. Before that, they didn't ask women, they didn't test women, and then babies were born with it. So they now do that for every baby. Here's the problem though. Gonorrhea is cured with antibiotics, but resistance is becoming a serious problem. What does resistance mean in the field of antibiotics?
Your body won't let you have,
Nope, that's allergic to the medicine.
medicine, whatever, like you keep it in your body.
Okay, it's not killing the bacteria as well. Now, it hasn't stopped doing it, but when it used to take one bottle of pills, it might now take 3 to finally kill it. Now, this has been going on for over 2 years. The CDC announced a couple of years ago it was starting to develop resistance. This is not a new thing with gonorrhea. It's done it before. And they've taken another antibiotic that works and started using it. And then it would develop resistance to that. Okay, let's use this one, and they'd start using this. There isn't one on the shelf. They've been working for over 2 years to find one that will kill the bacteria and not hurt the patient, and they haven't found one. And if they don't, this could become untreatable. It doesn't become viral, it's still bacterial, but it's nothing to kill it. Nothing to kill it. There'd be nothing to put in a baby's eyes. There'd be nothing to give the mom if she had it. So you can imagine what the rates are going to look like if that does happen. But so far, they haven't found anything. So CDC is very concerned about that. Okay, syphilis is the third of our bacterial infections. It's easier to spot. It comes in stages. Stage 1 is a painless chancre. It's called a chancre. And it would look when it starts as if I took a dry erase marker in red, touched it to my skin, and showed you. That's what it would look like. That's what it would feel like. There would be no feeling to it. Wouldn't hurt, wouldn't burn, wouldn't itch, nothing. It's a red spot. That's how it starts. If that were in your genital area or that of your partner, probably wouldn't see it, wouldn't even know it was there. But all you have to do is touch it and you can transmit it. Now, if over several weeks' time, it'll become the size of a nickel or a quarter. Now you're going to know it's there. If you go to the doctor while it's there and they test it, you got syphilis, here's your meds. Some people say, though, if I don't get rid of this, I'm going to have to see a doctor. Well, it's going to go away all on its own. That's a shame. In several weeks. But you still have syphilis. And if they didn't go to the doctor, in a few months, they go to stage 2. As you look at these symptoms of stage 2, if you take out the rash, you think you had the flu. But then there's this rash that starts on the hands and the feet. And then it works its way up the legs and arms. And it can last for several months with these big red blotches. That'll take you to the doctor if the chancre didn't, going, what is wrong with me? Test it, syphilis, here's your meds. So rarely in our day and age does anybody go beyond stage 2. Before the 1940s, when we had the meds, everybody went all the way through. And it goes into a latent stage, which can last for years and years and years. You're still contagious, especially during early latency. By mid to late latent period, probably not contagious much at all at that point. But at that point, it's getting ready to attack your vital organs, including your brain. This thing loves brain tissue, this bacteria. And it can actually cause you to go insane. They call it syphilitic dementia. They speculate that Van Gogh, Henry VIII, Al Capone, Hitler possibly all died having syphilitic dementia because they were very promiscuous in life. These antibiotics were not around, and they were pretty crazy when they died. So who knows? Who knows? Okay, moms can give syphilis to a baby during pregnancy. Infected babies can be born with or without symptoms. Which would be better, to be born with or without? Yeah, because then you know to start treatment, exactly. And you're going to see such a baby here in just a minute. If not treated, it can develop very serious problems or even die. Okay, first picture you're going to see, is, and I need to get I have to cheat on this now because we just redid these slides. And I have taught this program for so many years, I'm so used to how they always were, that I have to see how they are now because I don't want to tell you you're going to see something you're not seeing. Okay, I was right. First picture you're going to see is a chancre on someone's tongue. There's a chancre. Now, how would that have gotten there? Possibly. What else?
Oral sex.
Oral sex. And if he gives oral sex to someone, he or she, it can transmit to that person because all it takes is skin-to-skin contact. Now, this is in the small size. This is going to get bigger probably over time. It'll get about the size of a nickel or a quarter, and that doesn't quite look that size yet. So again, skin-to-skin contact. So anywhere it touches, that's where it's going. Most of the time, it's going to be knees to waist, mouth, because it's just not going to survive in other areas very easily. The bacteria is still in your body, so why would you cut it out? It's not going to do anything as long as it'll leave a hole in your tongue. So it's going to heal, and with medication it'll go away completely, and as will the bacteria. It's called going to the doctor, getting the meds, not starting off with a knife. No, that would be really gross. Okay, the next picture you're going to see, this is a chancre on a different area of the body. Now, we don't know if this is a male or female. I mean, there's nothing that, it shows an abdomen, and that's where the chancre is because that's where contact was made. Will a condom prevent that transmission? No. Nor from that transmission. Condom doesn't cover that. That's why with most of these diseases, you only get a 50% reduction of risk even when using a condom because there's all the skin that's still exposed in that area, and it'll transmit anyway, even if the condom's in place.
Put a plastic bag and a condom on.
A body condom,
Double layer.
straps.
Double layer.
Do not, no. We will talk about condoms, and that's one of the things the manufacturers even say don't do. Don't double them up, because that makes slipping and breaking worse. And they make twice as much money if they say, yeah, go ahead, but it makes it worse. So, yeah, you don't double them up. Okay, the next picture you're going to see is a baby. This baby got syphilis from its mother while it was in her uterus. She did not know she had syphilis. She had gotten it from her husband when they had sex when she was pregnant, which is normal. You can have sex when you're pregnant as long as mom's comfortable. He didn't know he had it. Where did he get it?
Oh.
I hear this it's so funny. Usually I get 2 seconds. You guys are pretty quick. Usually I'll say that, where did you get it? There's like a 1 or 2 second delay, and then you hear this, oh. What were you thinking? He cheated. Yeah, he cheated. So he had sex with somebody else, had gotten syphilis, did not know it, had sex with his wife, gave it to her, and then it transmitted to the baby. Here's the baby. This is an infant. Now this is not a baked potato. A lot of people say, oh, it's like a potato. Okay, this is hard when once you're a parent to see this. Yeah. Now, the baby's lying on, it's alive, it's lying on its back, here's the belly button. These are ink marks that I will explain. These are the knees that are bent over here. Here's one arm, the other arm would be up here, and the head would be over here. Get the picture now?
Yeah.
Okay. Now, how do they know to test this baby for syphilis? What'd they see? I know, it's an odd color. It's funny, it's not as bad on it. Well, it's kind of brown there too. This rash right here, that's syphilis rash. So they test the baby, it has syphilis, they'll put it on antibiotics, IV. They'll do an IV because they can't take a pill. Now, they will go to the mom now and say, ma'am, we had to put the baby on antibiotics because it has syphilis, which means that you have syphilis. Did you know you had syphilis? No. Is the baby okay? Well, yeah, it will be, but you didn't know you had syphilis? Who have you had sex with? Just my husband. Sir? Can you imagine how he's feeling? He knows exactly what's happened now. He didn't know it before, but he does now. How do you think he's feeling? Pretty bad, yeah. And see, he's going to be probably involved unless she leaves him, which who knows. But see how big the baby's belly is? It's that big because under here is a very large liver and a very enlarged spleen. They're part of the immune system, and they've been fighting the war in there trying to get this baby well while it was in the uterus. And they got very large, and they're not going to shrink, and they're probably not going to work right. So you've got an impaired immune system. Could also have brain damage. This baby's going to be in the doctor's office a lot. And every time it's all going to come back to dad. Bad choice, no self-control. How would you feel if you were the wife of this guy, ladies?
Oh, I like it. I'm not sick with that.
One girl in one class one time said, what marriage? One girl said, I turn him in, I report him. I said, who are you gonna report him to? The police? I said, they're not gonna do anything. There is one of these infections that's still on the books in Ohio, that if you don't report that to a partner, you've been diagnosed, you don't report it. Like, that's a felony. Which one? HIV. Now, understand though, a lot of states have taken that off their books. It's no longer a law in a lot of states. It still is in Ohio, but a lot of states have taken it off because herpes is not the deadly disease it used to be. We'll be talking about herpes in a few minutes. What time is it anyway? Okay. Okay, so again, BVID. Okay, herpes. With herpes, we're talking herpes 1 and 2. Herpes 1 is cold sores and fever blisters. Don't forget. You can get a cold sore or a fever blister doing nothing that is sexual, doing something that is not sexual. You could have gotten those when you were 6 years old and you kissed your grandma on the spine. She had a little cold sore in the corner of her mouth. And now you get cold sore. It's skin-to-skin contact. However, it went on the list of STDs because so many people were coming into doctor's offices in the last probably 10 years ago, it started, 10 to 15 years, with cold sores on their genitals because of oral sex being so popular. So enough people came in with cold sores on their genitals spread by oral sex that it went on the list as an STD. You can still get it not having sex, but it's there because of how it spreads sexually. It's spread through vaginal, anal, and oral sex as well as skin-to-skin contact. Symptoms can vary. People sometimes don't even have symptoms. The symptoms with this are lesions. Blisters that then break open, you have raw skin, and they can vary from very tiny to fairly good size. It's all individual. So some people don't get many at all. That can be transmitted even when there are no visible sores. What happens is you get it, and you'll have your outbreak within 2 weeks of having gotten it from someone through sexual activity. And so you get it, you're going to have an outbreak. It's going to last about 2 weeks with the blisters and the raw skin and the pain, either in the genital area or in the mouth and throat if it was oral sex. So those will last about 2 weeks, then they go away. You still have herpes, but it's not quite as contagious as during the outbreak. But you're going to get another outbreak. You just don't know when. Normal numbers 4 to 7 times a year, and they last about 2 weeks. With meds, you might cut that way down. As time goes on, they become shorter and less severe. You may not have as many as you get older, but it's a lifetime infection. To limit recurrent outbreaks, infected people need to learn to avoid or limit those things that trigger an outbreak for them. And that will differ from person to person. A lady I used to work with had a previous job, and she worked with a lady that had herpes. She'd had it since she was a teenager. She tried every medicine they could give her, nothing worked to slow hers down at all. You know what triggered her outbreak? Her menstrual period. So she got an outbreak after every menstrual period. Question?
What if it's inflamed? Is it more contagious when it's inflamed than when it's not?
I've never heard of it being inflamed.
Like when it
Inflamed? You're talking about having an outbreak? Yes. Well, that's when you're most contagious, yes. But you still can spread it between outbreaks because the virus is still in your body, and it can come to the surface even where you don't even realize it, and you can be contagious. So it's contagious 24/7, but not as much as during an outbreak. That's when it's most contagious, and that's when you have sores. But again, you'll see some are very mild. You might not even notice them. Stress, emotional and physical stress, not getting enough sleep, eating poor diet. If you have herpes, those things can trigger outbreaks. Emotional stress. You've got a big test coming up. Your marriage is coming up in a few weeks. That is not the time you want a herpes outbreak. But if you're stressed from that and you have herpes, prime time for an outbreak. Those are the things that can trigger it, and everybody needs to learn what triggers theirs. The only person I had as an attendant in my wedding, she had cold sores, and every time, because that's herpes, it's that herpes form, and every time she was out in the bright sun for very long, she'd get a cold sore. I told her to stay in the house until after the wedding, because she would get a big ugly cold sore if she was in the sun very long. That would trigger it for her. Okay, it's incurable lifetime. You can slow it down with the meds, but you can't kill it. Now, the first picture that you're going to see is of a pretty severe outbreak on a male. Okay, you're going to see male's genitals with the blisters on it. Now, I would think that would be very painful. That can also be that way on a female. You can get blisters in your genitals very similarly. That would be a very obvious outbreak. You'd be aware of that and it would be very uncomfortable. Or it could be the other end of the spectrum where you hardly see or feel anything. You'd have to look very closely because this is very magnified. But those little white dots in there, those are the blisters. She may not even know she's having an outbreak. And it can be everything in between. That's why this stuff spreads easily. People don't know when they're most contagious. So it's not going to probably kill you, but it'll sure interrupt your life. Okay, HPV, human papillomavirus. 14 of the 20 million cases of STDs every year are right here with this one. Now, there's more than 100 types of HPV out there, but only 40 of them would be things that would be concerning to us in this class and cause problems in your genital area and your reproduction. This is what I said, this is about that. Most infected people have on. Here's the good news. In most cases, the body's immune system clears the infection within 2 years. What's the key word in that sentence? Most. Even if you cleared 10 out of the 14, you're still adding 4 million to the 79 million that currently have it in this country. This thing is huge. It's huge. If it doesn't clear, it can cause genital warts and several types of precancers and cancers. It's the leading cause. Probably 95 to 90% of all cancer in females is caused by this. Vaginal and vulvar cancer.